Yeah.
It's 7 o'clock.
Oh, it's okay. It's starting. You can come sit with me because I feel nervous. Yeah. You might have to hold my hand.
Yeah. All right. Thank you guys for joining the Coaches Locker Room. You guys come on in. Share. Please hit the share button as you come in. We got a great show tonight for you guys. Hey, Paula, how are you? I know you're ready, Paula. Thank you for coming in. Thank you for getting that message to Pastor Tony, too. I'm gonna be coming to the church on Monday. I mean, on the 27th. I'll be coming to the church. So please hit the share button. I see a lot of you are already here. Don't be bashful. Come on in. We're going to talk about healthcare tonight. We're going to talk about quite a few things, but we're excited. Hey, Jennifer, how are you? Thanks for joining. We appreciate it. Hey, Miss Chestnut, thank you guys for joining. This is awesome. If you guys can see me okay, type A in the box. I'm back on my platform here. We got some great guests tonight for you guys. I also have some awesome praise reports for what a lot of you have done in the Coaches Locker Room with your credit. So I'm very, very excited. But I tell you, it's been, hopefully everyone had a great weekend. As you come in, please hit the share button. Thank you, guys. I appreciate it. Hey, Mr. Campbell, we got Who Dat Nation in the house from New Orleans. Thank you guys for joining. Hey, Latravia. Awesome, awesome, awesome. I hope y'all ready tonight. How many of you are all ready to learn about getting coverage for you and your family? I know a lot of you are like me, like, man, I can't believe that this is something that is even possible. What I'm telling you, with technology and the way it has gone here today, almost anything is impossible. Hey, Josephine. Hey, Rochelle. How are you? Thank you guys for joining. Make sure you share this link, this live tonight. It's going to be absolutely amazing. All your questions are going to be answered. Every last one of your questions is going to be answered. I'm sure by the time you guys listen and get the information right from the horse's mouth, you guys are going to say, Coach, I need this plan, like a lot of you have already mentioned. Now the time has come. And, you know, as I said before, I talked to some of you guys in the private group. I'm very, very excited and passionate about this opportunity. I got my family involved. It has been absolutely amazing. Guys, this is life-changing. And you know me, I would never present anything to you if it didn't have some character, some credibility to it. And like I said, this is not something that I wanted to personally share. I wanted you all to ask questions tonight. Ask all the questions you want, because I want you guys to walk away from this live tonight with questions answered. We're talking about a very serious subject here tonight. We're talking about healthcare. If you watch CNN like I do, and you see what's going on in our country, you know, with Obamacare and everything related to healthcare, a lot of people are impacted by it. A lot of people can't even afford healthcare of no type. But here's the thing: the sickness and the illness does not go away because you don't have healthcare. This has been a major, major blessing for me, especially. And you guys all know my story. I'm a diabetic. I have to manage my health. I have to do things outside of medicine to be able to make sure, you know, that I'm able to be on this live and to share this information and also to provide education. But as I've always shared with you all, this platform is about education, and you guys are going to get an amazing education tonight. I had a chance to meet with these two gentlemen, and they answered every question I could possibly think of. They answered every question my wife could think of, and I'm telling you, you know, it is something that it is a game changer. It's a no-brainer. It's all the words you can list where if you look at something, you say, could this actually be true? And I'm telling you all, this is a real deal. And like I said, I'm going to pop up on the screen and show everyone, all my folks that have come in. Let me get you guys on here. We can see here
that's cool.
Where we have we got Miss Paula in the house. We got Miss Houston in the house. We have Desmonica, Mr. Campbell, Latravia, Josephine, Rochelle. Thank you guys for joining. And as everyone continues to come in, you know, we want your comments tonight. Please ask questions so we could answer those questions for you and go forward. So, hey, Ms. Houston, how are you? Hey, Pam, thank you for joining. You guys are awesome. So what I'm going to show here, let me look at my notes here real quick, because I wanted to just kind of touch bases with you all on a couple things that we spoke about last week about building your credit. There are 3 things that I want to touch on very, very quickly so you'll understand if you're right on the right track. 3 keys. 1, you have to pay your bills on time. Okay, you cannot miss payments. It's very, very important. 1 missed payment could cost you 100 points, a 100-point drop in your credit score. Number 2, you must have revolving open accounts, credit cards, a secured card. That's 30% of your score. Most folks don't understand when they say, hey, coach, I don't want a credit card. I've been told, tear up my credit cards. That is the worst thing you can do. 165 points comes from having a credit card. So guess what? If you don't have a credit card, you can't get those 165 points. Payment history is 35% of your credit score. If you pay your bills on time, you get 192.5 points. Guess what? If you have a 500 credit score and you pay your bills on time for a whole year, that score goes from a 500 to a 692. How about that? This is amazing. This is the thing that I've always talked to you guys about education. It's very, very important that you understand the process. And that's why we talk here about trust the process. And a lot of you have trusted the process and have seen your credit scores jump 200 plus points inside of 6 months. This process works. And the reason why I'm recapping this is because what you guys are going to hear tonight is something that you can do right now. You can do literally right now. If you have coverage issues, if you have healthcare issues, if your deductibles are too high and you can't reach it to be able to tap into those other benefits that you have, take notes, ask tons of questions, and give these guys an opportunity to answer all your questions. If you guys are ready for me to bring my guests on, type A in the box, because these guys are sitting in the green room. They are waiting. We're ready to kick this show off and get these guys going. So if you guys are ready, type A in the box. I got my man Joey and Steve on my show tonight. Let me chime those guys in. Hey guys, how you guys doing?
Hey, how you doing?
We're doing
Good.
Coach.
Hey, you guys say hi to Steve and Joey, and I'm going to moderate this thing, and I'm going to have you guys make sure you ask questions, and we want to provide you with all the information that you need. So, Joey, why don't you go ahead and introduce yourself, to the coaches' locker room, all our members and listeners in here that are dying to hear about this wonderful product that you guys have launched, and kind of give them an overview how this all came about, because I think for most people that will wonder how this all came about, how is this possible, if you could share that with them, that'd be great.
Of course. So thank you for having us, Coach. Great to be in the coaches' locker room. We're very excited to be here and to share our amazing company with you and all of your followers. And how do I refer to them? As your players? Are they the coaches' players?
The team. That's the team.
Coaches' team. Okay, great. So we have a passion. This is my partner, Steve Utley. He's the Chief Financial Officer of the company. And I know you may not believe it because you're starting with me, but he is actually the real brains behind the operation. I give my pal a little bit something extra. We all have a passion to change healthcare. I believe probably you, Coach, and everybody that's on the call has had the nightmare scenarios where healthcare has just become a real problem for people. So we're trying to take the frustrations, the anxieties, and really create a platform, something very, very special that brings the doctors to you. So I'll start by saying all of our doctors in that network are all board certified. We have approximately 3,000 doctors in the network, and we are licensed in all 50 states and Puerto Rico. So whether you're home or traveling, the doctor is always in your pocket. That's kind of our motto. Put a doctor in your pocket. So it's with the technology, it has allowed us to do all of these wonderful things right through your cell phone or your computer. So if you come onto Coach's platform and become part of the Health Alliance Network, You will have full access to board-certified doctors 24 hours a day, 7 days a week, 365 days a year. Our doctors are available on Christmas and all holidays. So those days of, oh my goodness, I have to wait until Monday, I have to wait till it's the holidays over, I don't feel well, I have a sinus infection, those days are over when you are a member of the Health Alliance Network. And it works very simple. We've all gone to the doctor for sick visits. That is primarily what we're trying to take care of. We can cover approximately 50 different ailments and treat it right through our platform. All of the things that we have to go to the doctor for and sit there for an hour and pay the $100 copay, those days are over. If you aren't feeling well, you would sign right into your account or your app. You set an appointment with a doctor, and the doctor will come on your phone or tablet or laptop, whatever you might be using, and they will diagnose your conditions right through this platform, right through your phone or your computer. So it works very similar, just as if you were in front of the doctor. So we go to the doctor's office, and what do? Besides waiting an hour to see the doctor, which we're all very familiar with, we go into the doctor. They bring us into the office and into the waiting room. And eventually when the doctor shows up, they ask the same basic questions that our doctors will ask. How are you feeling? What's the problem? What are your symptoms? How long? Fever? Things of that nature. And they're going to make a diagnosis. Well, that can all be done through technology right now. So he or she will say to the patient, oh, okay, I think you have a sinus infection, so we are going to prescribe a Z-Pak. And the doctor will literally press a button because you already preloaded your pharmacy up under your profile. And the doctor will send that prescription, if he or she feels that it's necessary, to the pharmacy of your choice. So I'm going to let Steve pick up and cover some of the things that I missed, because I know there's a few angles that he wants to share with us.
Well, first I'd like to say I don't know how I can add much to that. That's pretty well done. But let me give you some idea of how we got started. We got started with one simple mission, and that was to provide better access to affordable health care. That was our only mission, our only goal, and we have been able to accomplish that through modern technology. Everyone's familiar with a cell phone. Everyone's familiar with FaceTime. Our technology allows you to make a visit with board-certified doctors, Joe pointed out, anytime, day or night. In what happens with anything in life, unless you have an experience, it's sometimes difficult to believe your own press. We started this, we were working on it for a year and a half to bring this technology and to bring the platform to fruition. I'd like to just share a very quick story because I think it makes sense. When we first started the platform and we were just launching it, my wife's aunt called her on a Saturday afternoon and she says, does Steve know any doctors? Of course I know doctors. I've been in healthcare for many, many years. And she said, what do you need? She goes, I need a doctor that'll just write me a prescription for amoxicillin. I have an ear infection. I know what it is. It happens 2 or 3 times a year, but it's Saturday afternoon. My options are this. I can go to an urgent care. It's $150 to walk in the door, or I can go to the emergency room, which is $700 to walk in the door. She says, I don't like either one of those options, and I don't feel like doing either one of those. Can he have one of his doctor friends write me a prescription? Well, the answer to that was no, we cannot do that. But we do have an option for you, and that is our telemedicine platform. It's the first time I actually shared it with anyone in my close circle, my relatives. My wife set her up on the telemedicine platform. In about 30 minutes, she called back. She was ecstatic. She talked to a doctor. She got a diagnosis for an ear infection. She had the prescription sent to the pharmacy right around the corner from her house. And in all of about 40 minutes, start to finish, she was done. That whole process, under any other circumstances, would have taken 4 or 5 hours and cost as much as $700. Number one, it didn't cost her anything for the telemedicine call. Number two, it didn't cost her anything for the prescription. In South Florida, as we have in many of the states, there are several pharmacies that will provide antibiotics at no charge. We have a discount prescription program that goes along with our telemedicine program. It is absolutely no cost. It's included in our telemedicine program. You can get many of the prescriptions for less than you would get if you even had insurance for a copay. Sharing a story, I think, is the best way to understand who we are and what we do. We have a passion for healthcare. We have a passion for helping people. And I think that says it all.
Almost all, because we're going to highlight that on our platform. When you do visit the doctor, I just want to really make it very, very clear. There are no deductibles and no copays. And there are also no limitation to visits. So it's not like you could say, oh, I'm going on this platform and I could see a doctor once every month or once every year. No, this is full 24-hour access to board-certified licensed doctors, and use it as many times as you need.
That's great.
We want to make sure that we're delivering the best health care. And on this platform also, at no additional charge, we also have dermatology services. Now, dermatology service works a little bit differently. You will not get a live dermatologist right in front of you like you do on the medical side. The dermatology requires you to just take a picture of whatever it is that is suspect to you, and you will go on your app, and it's very simple. You'll follow the instructions. You'll pull up the dermatology, take a picture, you will upload it, and within 24 hours, you get a written diagnosis from a board-certified dermatologist. And it's one of two things. It's suspect. I recommend that you go and see a local dermatologist and have it further checked out. Or, it's a freckle, don't worry about it. It's a mole, it's an age spot, basic things. That is also something provided to you at no additional charge. And I think any of us who've had experience with dermatologists, good luck getting in to see a dermatologist within a couple of weeks. It's always very difficult.
Right. Hey guys, let me ask you all a question, because I know it was, there was a couple of folks that I spoke to. They mentioned, what about if you have someone that's beyond their years, they're in their 60s, 70s, would this apply, say, to someone's grandmother or grandfather, because it's hard to get most people covered the older they are with pre-existing conditions? Would this plan help someone that's beyond their years and age, and or if they have pre-existing conditions? How does that work, and does that help them?
I'll take that question. That's an easy one. There are no pre-existing conditions do not matter. Anything that you would see a primary care physician for, we can take care of about 75 or 80% of that through a video call or even just a phone call. But there's one more important part about this that we haven't mentioned yet. For the same price, everyone in the family is covered. Everyone within a household is actually covered for one price. Every one of those people in that household have unlimited visits with a medical doctor, unlimited visits with a dermatologist. That doesn't matter if it's 2 people or 10 people. It makes no difference.
Wow.
There's no pay, there's no deductible, nothing more out of pocket. We encourage you to use our service. It goes hand in hand with one of our other accolades, which is better health, better planet. That's what we're looking for.
Wow.
We want to be a part of it.
That's a great response. If you all have any questions, please type them in the comment box. This is your opportunity to ask questions. And I have my own set of questions that I've gotten from clients that I've talked to that have concerns. Can you guys touch on how the deductible works? If someone works for a company, Josephine has a question. What is the gap for prescription? Can you guys see that in the comment box down there?
Yeah, I see it.
Okay.
I don't see it now. I did see it, yes. Yeah.
Okay. Can one of you take that question?
I didn't hear that, Coach. What is the gap for?
Josephine, kind of give us a little bit more information about that. But my question, when she types in the next question, what about, again, someone that's, well, you're talking about deductibles, someone that has a real high deductible, they work for a company, they have insurance already. Is this a good fit? And if so, how does that work with someone that already has insurance, but their deductible is extremely high?
I'm going to put some pressure on Joe right now.
Because he knows I'm the expert in this field.
He is the expert in this field. Joe and I recently made a presentation to the board of a very large children's learning center. They have, I believe, 64 schools in 16 states along the East Coast. And they wanted to talk to us because they already furnish health insurance for their 1,700 employees. So they wanted to talk to us about a supplement to that. So, Joe?
So we all have, I don't know, me personally, I don't know anybody who does not have a deductible. And typically the deductibles are very, very large. Also, if you happen to have, after you hit your deductible, like on my specific health insurance that I carry for myself and my family, so you got to hit your deductible. And then after the deductible, it's a 70-30 split for the copay. The payments just never stop. So since we created our new company, I have really been able to streamline and save a lot of money when it comes to myself, my wife, and my children with the normal primary care physician's treatments that are pretty regular in my family, at least. So now, instead of going to, I don't want to say my doctor's name, let's call him Dr. Smith. If I'm not feeling well or I believe I have a sinus infection, I'm not going to go to Dr. Smith because it's still, even under my plan, was a $85 visit as part of my deductible. So now, when I go and see one of our virtual doctors, that costs me $0. So right there is no deductible, no co-insurance. So irrespective of me having health insurance, I will only use that in the event of a substantial emergency or, God forbid, of course, some type of family sickness. Now, one thing I do that we did with the Children's Learning Centers is they are actually custom tailoring their healthcare plan, because they have found that most of their insurers on their platform in their company do not hit their deductibles. That is very, very significant, because the premium that the company is paying for those employees to have the insurance has a lot to do with the deductible. So the higher the deductible, the less cost it will be to the employer to provide health care for that company. So what they're doing with us is we have a special pricing. I'll let Coach touch on that after. We have special pricing that is a employer pricing. It's discounted from the $35 that we have on the individual plan now. And they're going to give their employees both benefits. So they're going to still carry insurance for catastrophic or something very substantially wrong with somebody. And they're going to give them our affordable health care through their smart devices, which gives them immediate access to doctors 24/7. So the way they complement each other, I actually like to say we are the complementor for sure, because having our product for most people is the right thing.
Okay, great. Josephine's question was, when a patient has exceeded their prescription allotment and has to pay full price for prescriptions, they're told they have fallen into the gap.
Oh, that's a great.
Yeah, in the healthcare business, they call that the donut hole. They're in the donut hole or the gap. Exactly right, in the healthcare business. So one of the things that we did at Health Alliance Network is we entered into an agreement with a pharmacy benefit administrator. Now, that's a fancy word for we can get prescriptions substantially less than even insurance companies can get them. For example, one of my employees used her telemedicine benefit because she had something going on, and we have also health insurance at our company in addition to telemedicine. She told me that she went to the pharmacy, she got a prescription through her telemedicine, she picked up her prescription. She goes, it's a little bit of a difficult prescription, it's a little bit pricey. I said, what did you pay for? She goes, well, with our insurance plan, I paid $54. And I said, did you use our discount pharmacy benefit? And she goes, I completely forgot to use that. Steve, I'm sorry. I said, well, just for fun, play along. Let's see what it would have cost you had you used our own program. So we went onto our program. We just simply entered the medication. And with our program, it would have cost her $36 as opposed to health insurance cost her $54 for the same prescription.
Wow.
It is amazing what it does. We've worked very, very hard to bring a meaningful benefit to all of our customers. We want to service the entire population. We know there is this extremely underserved population in America for healthcare. Many people go without it. They have to make a decision, do I want food or do I want medication? Right. Well, we want to have both. So we've worked out both sides of that coin for everyone. We have telemedicine, which is extremely affordable. If I understand Joel right, he said it was $35 a month.
Yeah, really.
For the entire household. And we have contracts through the discount pharmacy benefits administrators. Basically, that covers both ends of the spectrum. Anything you would normally go to your primary care physician, we can handle with telemedicine in most cases.
Right. Okay, great. Great answer. I have another question for you guys. You can see Jennifer Houston. She said, if the illness isn't one of the 50 that you all cover, what will happen? If it is not covered, the illness, basically she's saying if the illness isn't one of the 50 that you all cover, what will happen?
Can I give an example?
Please do.
Let me give another example. About a month ago, our bookkeeper to our other healthcare company, we have a nationwide healthcare company in addition to this. Our bookkeeper for our other healthcare company come into my office. She could barely speak, and I could tell she was deathly ill. And I said, why are you here today? And she said, well, it's payroll. I got to make sure we get the payroll out properly for all of our employees. And she goes, I said, do you know what's wrong? She goes, I'm sure I have strep throat, but I don't have time to go to a doctor for strep throat. It's an all-day event for me. I've got to get the payroll out. And I said to her, I said, have you tried our telemedicine? She goes, I have strep throat.
She didn't realize.
And she said, exactly. She didn't realize she could use it. She goes, I have strep throat. Don't they have to do a culture? And I said, I don't know. It's not listed on our 50 items. However, give it a try. So she goes into her office, and about 10 minutes later, she comes back, smiling the best she could. She goes, I have strep throat. And she goes, that was amazing. And she goes, he's already sent the prescription over to the pharmacy that's about 2 blocks from our office. That prescription will cost me nothing. She got a Z-Pack for strep throat. It will cost me nothing. The phone call costs me nothing. And I still get to work without sitting in a sick room for 4 hours.
Wow.
So we attempted to address the most common 50 ailments that you would go to a primary care physician for. We've had our members call us and tell us about things that I never would have imagined that they would diagnose and write a prescription for. One of them was shingles. One of our members called me and actually sent me a picture that she had a small little rash on her shoulder. And she said, just to see if I could get something diagnosed, I used the telemedicine. The doctor says, clearly you have shingles. Here's a prescription for it, and go pick it up.
And caught it way early.
Caught it way early. And she said, had I not had telemedicine, I probably would have just ignored it. It looked like a small rash to me until it got out of control. Another clearly shingles is not on our 50 items to diagnose. Whatever the physician feels comfortable with diagnosing you with, they will. It doesn't matter what it is. We've seen diagnosis here recently. About 2 weeks ago, a lady had gout. And the physician diagnosed her as having gout. She used our pharmacy benefit, and the medicine that she was paying $200 for would have cost her $200 for her gout. She paid $81 for it. It's amazing. So although we try to list the most common ailments, there are many ailments here that we don't list on there that can be diagnosed and get a prescription for.
Coach, I just want to add to something because this is a very interesting statistic. So as it stands today, we get our monthly reports. This is a very, very, very important part I want to point out to everybody. 9 out of 10 people that visit our platform result in a cure. So that means only 10% of the people are referred for further treatment. Now that is a gigantic statistic. So we are serving most people are getting what they need and expect when they visit one of our doctors, and that is a very large number.
And I should preface that by saying, for those that are just joining, hey, Mark, if you guys are enjoying this great information from Steve and Joey, type A in the box if you guys are happy with what you're hearing, and this makes perfect sense to you, because I'm telling you, this is a game changer with what they're sharing. There are some things that I'm still learning that they just spoke about with, conditions that may not be listed on that 50. So basically, there's no limit to what this could be. But also I want to say, Steve and Joe, Josephine asked, she said she understands the co-pays for no doctor's visits, but she said, what about a specialist?
We have specialists. We have many specialists. It depends on what the needs are, but we have many specialists. We have pediatricians. We even have oncologists on staff. So it depends on what the specialist. And I don't want to ask her what she needs. That's not of our concern at this point. But yes, you do have access to specialists. Yes.
Okay. Great.
And we have the dermatology, which you have access to dermatologists and specialties in the dermatology. When you go on the platform, you have an option to pick which physician you want to see and what their specialty is. You get to see, basically, you see their resume, you see where they were educated, you see how many years they've been in practice, you see where they are physically located right now. And if you want to see that physician via your telemedicine product over and over again, you're welcome to pick the same physician.
Correct. Okay, great. Okay, Jennifer asked a question for you guys. She said that Jennifer, by the way, is she's my real estate coach in my coach's locker room. So she asked some great questions. And the other questions she asked, she said, you just mentioned you have another healthcare company. What's the difference in this healthcare company and the other one that you mentioned?
We have a couple of healthcare companies. We own home health agencies here in South Florida, which is what it is. We get a referral from a physician. Generally speaking, it's from hospital transition to home, and we get a physician's order for wound care, for IV treatment, and that sort of thing. That's a Medicare-funded agency, and we service mainly the senior population. In addition to that, we have a chronic care management company that manages chronic conditions for the Medicare Advantage population, the Medicare Advantage population throughout the United States.
Okay, great. Yeah, the questions are starting to roll in. Someone, Josephine asked specifically a hematologist, and then Paula asked pain management doctors. So can you guys touch on those? About, I guess, with the specialist, she mentioned what about a hematologist and pain management doctors?
I have seen hematologists listed in the physician profiles in our network. So the answer to that is yes. And on pain medication, the answer to that is absolutely no.
No, we don't do that.
We don't do that. Anything that's a DEA-controlled substance, well, ultimately it's up to the physician, but we strongly recommend that our physicians do not prescribe a DEA-controlled substance, an opioid, or anything of that nature.
Okay, great. And then can you guys see Jennifer's question? She said if lab work is required or x-rays, et cetera, we will go to our primary physician. So she's asking a question about that.
If you need lab work, Joe should probably address that if you need lab work. First of all, let me say that we are working on a nationwide contract for discounted lab services also. But Joe, you want to address the lab service?
Yeah, so great question. I don't want to overpromise, but as Steve just mentioned, we are trying to bring that into our company as an added value, as no additional cost to our members, but it will be at a discounted rate, just like we were able to achieve with the prescriptions. We're trying to get the same thing for the lab work. We feel that healthcare is the most important thing to all of us. That is one thing that is so common for every single one of us, is having great access to healthcare and affordable healthcare. So if we can land this agreement, we will be delivering that to the members, no additional charge from us, and it will be a substantial discounted rate for basic lab work and things of that nature.
Coach, I, as you know by now, I enjoy giving illustrations and examples of things that have happened.
Yeah.
Just recently, this is something that happened to me very recently. I had some terrible pain in my shoulder and my neck, and it was just unforgiving. So I went to an acupuncturist to see if I tried that in the past, and it helped me. The acupuncturist said, I strongly recommend you get an MRI so we can actually identify exactly if there's a real problem there. And he says, do you have insurance? I said, I do have healthcare insurance. That would be obviously lab work, considered lab work, the MRI. And he goes, I strongly suggest you get an MRI. Here's one by your home, et cetera, et cetera. So I called him up and I said, I need an MRI. And do you have insurance? I said, yes. I said, yes, I have insurance. Who is it? I gave my insurance information. They said, your copay is $610. I said, okay. I said, is there another option just to walk in with cash? And she goes, yes, there is. If you walk in and just pay cash, it's $300. I'm going, really?
Yeah.
Really? Well, the reason is because of the process with the insurance companies. They may or may not pay them, depending on how the company processes the claim. If I walk in and pay $300 cash, they're paid. And the interesting thing about that, I want to point out to your audience that sometimes you just got to ask, can I get a discount? And then you can. There's a local physician here that is actually part of our network as an affiliate agent with us. And she wants this because she offers discounts to her own population. If they don't have insurance, they can walk in and pay a one flat price. She charges them $75 to walk in for anything.
Wow.
I encourage them to come in about every 6 months. And I said to her, this is how the conversation started. I said, well, what do those patients do for the gap between the time they see you now and the 6 month checkup? And she goes, they have nothing. They can't afford anything. And I told her about Health Alliance Network. That's what got her interested. I said, this will fill the gap between the primary care meetings with you and anything that happens in the meantime.
Sick visits.
Wow.
Yeah.
That's great. I didn't know that either. That's really good information, guys. Paula asked, what about children that need immunization, or you got parents that have infants? How does this work? Can you guys give an illustration or an example of how this would benefit a young family with little kids?
I would love to give an illustration. I was giving a presentation to an Obamacare Affordable Care Act agency that is about to lose all their customers in South Miami. And during that presentation, one of the board members asked me that exact question. And they said, if my child, my infant, my toddler is sick at 2 o'clock in the morning, can I use the service? I said, you can. And so how are they going to know if my child has a fever, or how are they going to diagnose it? And I said, well, it's very simple. As the physician's going to ask you, do you have a thermometer? You're going to say, yes, I do. And he's going to say, or she's going to say, please show it to me. Show the thermometer. Do you know how to use the thermometer? Yes, I do. Demonstrate that for me, please, over the video. Yes, I do. Here's how I use it. Take the child's temperature and hold the thermometer up to the camera. Okay, I see the temperature. Clear the thermometer. Do it one more time. I see the temperature. I told the story because this is a true story about how that happened. And one of the other board members says, I have the telemedicine. I have this product. And that is exactly what happened to my 2-year-old. 2 o'clock in the morning, I would have gone to an emergency room because it's our first child. My wife was in a panic. We used the telemedicine service, and that is exactly how it went. They told me how to treat the symptoms, and if it didn't get better within the next 4 hours, then you do need to come into an urgent care or an ER facility.
Wow.
But immunization has nothing to do with the platform, though, to be very clear. As you would see your PCP for your regular shots. I'm sure the children would want something different, right, Coach?
Yeah, absolutely. Okay, you guys could probably see we got some really good responses here from Jennifer. If you could see her question, she mentioned about a colonoscopy. She said working on getting discounts for that, even with some insurance company, is very, very expensive. You guys address that at all?
Colonoscopy. I don't have an illustration for that.
No, just what she was talking about, that I guess how expensive it is. We're trying to get a better price. And then Josephine wants to know, Josephine, I will get you that information. She wanted to know where can she get information to bring to the church or do a presentation to church groups. So Josephine, just tell me where you are, and I'll call you afterwards, and we can make arrangements to get to your church and do a full presentation. How many of you guys, based on what you're hearing, can benefit from this product? Because I'm like, my whole thing is, where could you get additional services for $35 a month? And if I'm wrong, guys, just correct me, that it doesn't cover, when you talk about covering your entire family, if there's a limit to 2 or 3, if we can just kind of recap and just be clear, and so they understand, if they're saying, okay, I have a family, I have 10 folks in my family, can I cover them? Or, if I work for a company, is this something that I could, my company could use and be able to have that as an addition? And guys, just remember, we're talking about the individual plan, the actual plan for which I listed, the one for $15 a month, that comes through your company or your job. If your employer offers this would be a great segue to get you the additional in case you can't meet the deductible. This carries you through until you hit that point. Am I right in what I said, guys? If I'm not, if you guys can clear it up, and I just want you guys to recap everything to make sure that they know exactly what's available to them, unlike anything else out there in the marketplace.
Touch on the first one. I'll touch on the.
All right, great. 100% accurate, Coach. And it extends even beyond the immediate family. Say you have a child in college. We live in Florida. Our child is in college in Texas. It extends to the child in Texas.
That's me too.
Right. If you are traveling, this happened to us very recently. We are in Florida and we were traveling to Chicago. I don't have a doctor in Chicago. I can't even get in touch with a doctor in Chicago. I don't know what to do. So I called, or I used my phone. I used my phone and our telemedicine service and talked to a doctor instantly in Chicago. That's how well this program works. And we literally, to reiterate what Joey said, you have a doctor in your pocket no matter where you go, no matter what time of the day or night it is, whether it's a Saturday, a Sunday, or holiday, 2:00 in the morning or a Tuesday afternoon, it makes no difference.
Wow, amazing. So it really doesn't matter, guys, if someone is in California, if you take a trip out west to California, say if you're in a remote location where there's not a lot of, you don't have access to go to an emergency room or, a local, clinic, how does that work if someone is out in a remote area where they don't have access or they can't drive in? Could you explain how that would work?
Sure, I'll take this one, Steve. So this I think is my favorite part of our product. Imagine being able to see a board-certified doctor from your couch with your feet up at the convenience of your home. I mean, right, we chuckle, right, because it is unbelievable.
Yeah.
So instead of getting in the car, if I called my primary care physician, here's what happened to me. It was maybe about a year and a half ago. So I had a sick visit, and I did call my primary care physician first thing, 9:00 in the morning. I am ringing your phone, and I say, "Hi, can I speak to Dr. S? And can I see Dr. S? I need a sick visit." And the answer immediately was, "Absolutely not. You can see the nurse practitioner, and she is available at 4:30 this afternoon if you would like to come see her." So desperate as I was at that time, I knew exactly what I had, and I just needed the Z-Pack. So 4:30, I go there, and if my wife was standing next to me right now, she would be shaking her head, giggling, because I sat in that office for 2.5 hours before she came into that room. And I was texting my wife saying, "This is unbelievable. I literally could have drove to Disney World from South Florida in the time that I have been sitting there." And she spent all of about, I would say, no kidding, 3.5 minutes, wrote me the Z-Pack, patted me on my back, paid my $85 on the way out, and then I had to go sit in Publix for 30 minutes and wait for my prescription. So having this right at your fingertips from the comfort of your home, office, car, you could be driving across country and have it. And it's unbelievable. And just to touch on what Steve said, if anybody's traveling, one great thing about our product is our app will geolocate you. So if you're living in the state of Florida and you do travel and you need to go on our service and you sign on, the first thing you will see is a message that says, we noticed that you are in New York, and it asks you to confirm. You will confirm. Then it will ask you, would you like to choose a pharmacy? Because it is assuming that you are coming on the platform for a doctor's visit. And it will geolocate the pharmacies near you, and it will say, would you like to select the pharmacy now? And then boom, at that point, you will get a board-certified doctor in the state of New York, if that's where you are. And it will be the same process just as if it was in your home state. And the same benefits carry, no co-payments, no deductibles.
Wow. Great, guys. Paula asked a question, and it kind of falls in. She says, how do we find out the price of prescriptions we're already taking? And Joey, you and I already talked about that. Paula, today I put in all my medications for my diabetes, my high blood pressure. I put that in, but I'm going to let these guys explain it to you. She said it sounds as though all scripts would be cheaper through your program. And then she said, what about blood pressure meds?
So blood pressure medication, I think it's what, Lipitor?
There's a number of them. Yeah, there's a number of them out there.
That happens to be one of, if you live in the southern states, that happens to be one of the free medications that Publix does give to its customers for free, as well as some diabetes medications as well that I happen to be familiar with as well. If you're sick, so let's just hit the sick visit. There's generally only a few antibiotics that are prescribed. Amoxicillin, penicillin, ampicillin, SMZ. So those things, again, for us, at least in the Southeast, those prescriptions are free under the Publix free medication program, as well as the blood pressure and some diabetes medications. Now, to answer the question about all other medications or things of that, as Steve said earlier, just if you're on our platform, you will go into the benefit of having the benefit administrator as far as which medication it is, and the price will just appear, and it's really that simple.
It'll show you. You just type it in the search bar, and it figures out pretty quickly what you're asking, even if you can't.
Right. Yeah, I did that today, guys. I just kind of searched and put in lisinopril for my blood pressure. Then I put in metformin. Guys, listen, I'm going to tell you, this whole back end is absolutely amazing. It's almost like you're walking in the pharmacy and you're just like looking at all these different, you put in what prescriptions you're taking. It gives you every scenario and you basically pick, it's just so much information. But I'm telling you guys, it addresses a lot of needs that most people don't have. But I think, it's a great product. And like I said, I signed my family up for it. It was a no-brainer because, again, I take two medications. I take metformin and I take lisinopril. And you guys know my story. It's helped me to address making sure that I at least have my meds. And then it also tells me, guys, I put in earlier, it says putting where you live. And right when I put in my address, right to the right side of the screen in my account, all these pharmacies popped up. What's the nearest? What's the farthest? Listen, it's a no-brainer. You can be anywhere in the country. You can be in Istanbul, and if there's a GPS tracker that takes you out there, it's going to pull up where you can get your meds. But again, like I said, it's amazing just what they actually what they've done with this product. And then Jennifer asked, she said, what about a podiatrist? She mentioned they were talking about specialists a little while ago. She asked, what about a podiatrist as far as a specialist?
I've also seen podiatrists listed in there as a specialty. Absolutely.
Right. Can you guys touch on because I know when I met with Joey and we went through the back end where you have all the doctors listed, doesn't it, when you have you got board certified doctors, right? And a lot of them have different specialties and skills. So isn't it a matter of searching for what type of doctor you're looking for? And in their resume, guys, it's outlined what their specialties are. And I think that's just a little bit of a homework to find out if you're looking for a doctor with a specific specialty based on what you're looking for. I think it's more of a little bit of research and homework and looking in the actual platform and seeing what's available to you, right?
That's correct. And in the platform, at the very, if you're using your phone or if you're on your computer, at the top right, there's a couple of little lines up there. And those, if you click on that, there's a drop-down menu, and what you'll see is doctor by location, doctor by gender. Maybe I want to talk to a female doctor if I'm having a problem that I'd like to talk to a female doctor about. It'll also give you an option to speak to a doctor by language. We have 130 different languages that doctors speak that's built into our platform. It also gives you the option for specialties too. So there's a whole array of search elements in there that you can look for a doctor.
Wow. Okay, great. Great, guys. We have about 10 minutes left. So if you have more questions, ask, because I want you guys to walk away getting all the information you need. And then I'll post a link at the end for those of you that want this service, and you can have that service right away. Joe, you did mention when someone does sign up for the individual plan, can you kind of walk them through what that's like? What's kind of the grace period before they actually get access to the services, so on and so forth?
Of course, Coach. So with that, you just made me think of something else as well. So when you do sign on to the Coach's Healthcare, it's a very, very simple sign up. You just follow the prompts. It is very, very self-explanatory. After you do sign up and put in all your information, it typically will take approximately 72 hours for you to receive a link with very simple instructions on how to get into the platform. It will ask you to create your username and password, and then at that point you will be able to use the services anytime that you want. Now, the other thing is, all of our doctors, I wanted to point out, are all, of course, as we said, board-certified doctors. So I just want to make it clear, we do not use nurse practitioners. We do not use nurses. And one very important thing that I like to point out is the average experience of a doctor on our platform is 15 years. So it's not like, oh, we're getting, which, no disrespect, of course, but it's not somebody new who doesn't have as much experience. So all the doctors are very, very well experienced in the network. So it's a very simple process. Just sign right in. Within 72 hours, you would be receiving your link. And from that point on, you have full access to healthcare. It will prompt you to add family members during that sign-up process.
And you can add them anytime you want.
And that is correct. You can add them later if needed.
Say you get more family members tomorrow. That happens.
that does happen.
That does happen. It's the process. Let me point out the process is very simple. There's very few questions you got to ask. You need to know your name, or you need to have a name, an email address. You need to know your gender. It's going to ask you if you're a boy or a girl, and you need to know your date of birth. Beyond that, that's about it. You're qualified.
Yeah, we do not ask for driver's licenses. We do not ask for social security cards. We do not ask you to provide health records.
None of that.
Now, once you are signed up during this, and you are able to get into the system, in your profile, if you would like to share on your profile when you have a doctor's visit, if there's anything you want the doctor to immediately know, that's at your discretion. You could put that in your profile. Hey, doc, I have type 2 diabetes, just so you're aware of.
And you can upload photos too.
And you can upload photos of yourself or anything else that you may feel is relevant.
Exactly.
To the thing. But that's not mandatory. That is an individual's choice.
We included that as part of the platform. We felt, for many, many years, I felt that we all should have control of our health records. They belong to us, but for some reason it escapes me why you can't get your own health records. So we built it into the platform to have a personal electronic health record that belongs to you, and you have access to it. Other members of your family that are adults do not have access to your health record, even if they're married. Your spouse does not have access. However, that being said, you can allow them to see them by giving them a release. I gave, obviously, my wife a release. I want her to know what my health is, and she gave me a release. She lets me know what hers is.
Right. Okay, great. Jennifer asks, what is the cancellation policy, and is there a commitment time frame?
My favorite question. Joe, answer.
There is no cancellation fees, nothing of that nature, and there is no commitments, no contracts.
It's month to month.
Cancel at any time.
Yep. Month to month.
Month to month. But I can assure you,
you won't.
You won't. When you have the product, you definitely will not, especially being so affordable.
Okay. Josephine said, I need to sign up my son that's going to college. Will we receive an insurance card or just an ID number? So I guess that kind of walks in what happens when you sign up, what do you receive? So if you guys can go through that.
Yeah, so you said Josephine was her name?
Yeah, Josephine, yeah. Mm-hmm.
Hello, Josephine. So actually what I would recommend doing is Josephine should sign up herself. And then as she's going through the sign-up process, she could add her son as a benefit recipient. And it's really that simple. So he will then get a link sent to him as well so that he can go onto the platform and create his own username and password. And it's really that simple.
Right. Great question, guys.
For that same one fee.
Right. Josephine, also, just to touch on what they said, I have two that are in college. And, I signed my wife up. She got the email. She set up, you get a username and password, and then I put my son's information in. He's going to be a senior this year, this upcoming year. And then I have a daughter that's graduating this year. So we put them in, and they're all covered. They have their own, so they can basically use their phone if they're in college and something happens, they're taking finals or something happens where there's a change in weather and they get sick or they get a cold or something. Instead of them running down to the clinic, university clinic, they can do it right there from their dorm room and get the treatment that they need. Find the nearest pharmacy, go get the prescription, and you're done. Right, guys? Hopefully I'm saying this right, but that's my worldview of it with my own two kids that we have them on the plan that they have to cover.
Coach, you are 100% correct.
Coach, I have a prediction for your audience.
Yes.
Two predictions. The first one is that if you are under the age of 10, not your audience, but if you are a human under the age of 10 right now, by the time you're 16, there's two things that you won't have. One, you're not going to have a driver's license, but you're not going to need it. Number two, if you try to convince someone that's 5 years from now that I need to go see a doctor face to face, that's not going to happen.
Yeah, it's changing.
It's going to be like me asking you to send me a telegram instead of a phone call. Yeah. It's not going to happen.
That is true. And guys, here's what I want to do, and I want to get some feedback from you all. Steve and Joey is going to be on next Monday, and what we would like to do for those of you that are visual like me, that we can do an actual visual presentation of what the whole process looks like once you log in, so you can kind of see the big picture of it and how everything works, what the doctors look like, so you can see the back end of the platform as a consumer. If any of you would be interested in seeing that, just type A in the box or type yes, and that will give me an idea for what the three of us can do to put on a presentation for you all next Monday night. So if you're interested in seeing a demonstration of the back end of it, just type A in the box. And at the same time, Josephine says she's on Medicare due to some strokes. She says she's covered. She says, do I have to sign up? So not quite sure, but what do you guys?
I'm not clear on the question, Coach. She's on Medicare. And does she need to sign up for our service? Is that what you're asking?
Yeah, that's what she says. Do I have to sign up? She says she's on Medicare. I think what she's more interested in is her son's going to college.
Oh, gotcha. I misunderstood. She does not have to sign up. It does not affect her Medicare benefits whatsoever. That's the question. It does not affect our Medicare benefits.
Can you elaborate on that, Steve? Say if someone does have certain coverage that addresses specific needs that they may be dealing with, how does this work in conjunction with what they have? Because I think most people probably out of fear that if they pick up another plan or something, that they may run the risk of losing what they have. So I think if you can kind of clear it out.
Great question. Let me just say this, and this will sum it all up. This is not insurance. This is a membership plan that gives you access to our board certified physicians. That's it. It's no different than if I was on Medicare and I had a sore throat and I'm traveling. It would be no different if I walked into an urgent care center and paid cash for a visit. It doesn't affect anything else in my life. An urgent care visit is just a subscription or a membership payment at that time. We just have made it much more convenient than actually doing that. So it does not affect any coverage whatsoever.
Okay, great. Does that make sense, guys? Because I want you guys to have a comfort level in the benefits of this. And, my whole thing is the more I look at this pamphlet here, and I'm going to post this in our private group, but some of the things that they mentioned, no waiting room visits. But the big thing, and I don't know how much you guys touched on this, about the dermatology. If you need a dermatologist, unlimited dermatology visits for the member or the entire household. And then can you guys talk about the counseling part of it? Because I thought that was very, very, interesting with those two things, because, most parents that have young kids and they, especially here in Florida with the humidity, they may have skin problems. Can you guys address that?
How about I take dermatology and you take behavioral health? Sounds great. Great. Dermatology, great question. Anyone who has a preteen or a teenager, they're going to love the service. That no longer does the teenager or the preteen or the member need to go to a dermatology for routine conditions. A dermatologist can issue a prescription. And a lot of prescriptions are issued for skin conditions, something as simple as acne or a rash, or there's a myriad of skin conditions that a dermatologist would issue a prescription for. So to touch on that, it's interesting to bring it up because it's one of the more important aspects of what we do, and a lot of people don't recognize that because they won't bother to make an appointment to see a dermatologist for two reasons. Number one, they don't answer their phone. Number two, you can't afford it. But now you can. If you have a condition, a spot, a rash, acne, anything you're concerned about, you log onto the platform, you take a photograph of it. I've used it, and what I do is I take 2 or 3 photographs, and then I submit it. I don't have to email anyone. It's built right into the platform. I push submit, my record, my images, my concern goes to a dermatologist, and usually it takes about 8 to 12 hours for me to get a response. And then they respond back, and they say, "Thank you, Steve, for your submission. Here's what I think." And that way, it puts my mind at ease, and it's convenient. And under any other circumstances, I simply would not have gone to see a dermatologist. I just wouldn't do it. Right. In fact, I've never seen a dermatologist in real life. That's the bottom line. I've never done it. I'm not going to take the time out of my day.
Most people procrastinate.
They do. They procrastinate. Behavioral health.
So behavioral health, again, we're trying to give people, we're trying to make people's lives better. And I believe that we're trying to encompass as much, day-to-day things that people have in their life. So the behavioral health is very simple. We give each member 3 hours annually of behavioral health. So if you're just having a tough time or down on your luck, and you feel like, hey, you know what, I really want to speak to someone, get some things off my chest, we will include 3 hours annually at no additional charge. We feel that's very, very important because we've all, I don't think anybody has not gone through a rough period in their life. So we try to help with that. If it is something that you, let's say you see Dr. Smith and she's really helping you and you say, I really would like to continue to use Dr. Smith. She's really helped me a lot. I already used up my 3 hours that were included. You can continue to see her at a discounted rate. But that is through her. We would not be collecting the money. That is kind of a side thing that we just help you out.
That's correct. One of the things I talk about behavioral health, I just read a study that I believe it was Harvard just released it, that they looked at telemedicine, the behavior aspect of telemedicine versus face-to-face visits with a psychologist or a counselor or a behavioral health specialist. And they said that telemedicine was 80% more effective than a face-to-face because people were more willing to express themselves and share what was really going on in their life, and they didn't have to look across the table at somebody.
True.
80% more effective. We love that service also.
Right. Absolutely. Great, guys. These are some great questions, and we really appreciate it. Couple more questions, and then we're going to close it out, but we will be back on next Monday. Jennifer said also, if the Affordable Health Care prescribes something, it's our responsibility to update our primary care physician with any new prescriptions, especially with allergies, etc. Or do we update our profile with the current medications to avoid allergic reactions or combining medicines?
You want me to take that?
Yeah, no,
I believe I understand what she's asking me. If she has a primary care physician in the electronic health record, there's a place to enter all of your other physicians and or specialties. There's also a place in there that when you do use a telemedicine visit, you call one of our doctors, the doctor prescribes something for your condition. That information is entered into your health record. That information is also made available to your primary care physician or your specialist because it's part of your health record now.
Okay. Does that make sense, Jennifer? Let's see here. I'm just checking here to see if we have any other questions. One last question. One of my other clients came in. He said he just came in late. He just got off work. He said he wanted to know how the prescription is handled. Do you just pay full price out of pocket?
You want to address that again? You want me to go over that?
If you could, briefly.
Happy to do that. We were very excited because we know one of the missing elements to this to healthcare is the prescription program. Particularly if you're talking about telemedicine, we realized early on that was something that would be very, very important because prescriptions are downright expensive. So we started early on. What can we do about that? We ended up getting an agreement with a pharmacy benefits administrator nationwide. What that allows us to do is anyone who has tested our system will confirm this. It allows us to buy medications at a deeply discounted price. Generally speaking, you're going to get a discounted price off of retail somewhere around 80 to 85% off of what you would pay if you just walked in the pharmacist.
Wow.
So that said, our price is most often less than you would pay as your copay for your normal health care insurance. Right, exactly.
Wow, amazing. Oh, amazing. Wow, I didn't know that either. Paula asked, so the family all needs to live in the same home at the same address? She said, if my son didn't live, basically she's saying, do they all have to live under the same household to take advantage of this plan?
In the application, to ask you either during the sign-up process or there's a button there that's right at the top of the page that says add a family member. You just click the button and it asks you for the name, the gender, the date of birth. That's the three questions I'm going to ask you.
Yeah, Paula, they don't ask for addresses or anything like that. There's a button on the left that says, add dependents. And you basically just enter the information. It's just basic information, Paula, and it's really, really that simple. I wish I could tell you guys that it was more complicated than that, but it really, really isn't. And
hey, Coach, just to clarify something you said there, Coach, it doesn't say add dependents, it says add family member.
Yeah, add family members, right. Sorry about that. Yep. Let's see. Okay. Someone says this is a family plan. No, Denise, it's the $35 covers the entire household. Correct, guys?
That's correct. Yes.
Because I think they're thinking the $35 is just for them because it says an individual. Can you guys clear that and make sure we're clear on that before they walk out? So they're going to explain what you get for. I tell you what, guys, let's just explain what do they get for the $35 and who has access to get all these great benefits for $35.
Hey, Coach, can I answer that one?
Yeah, go ahead. Have at it.
I live in South Florida now, but I'm from Kentucky, and I can answer that with a simple Kentucky saying: you get the whole kit and caboodle.
There you go.
You get everything for $35. You get medical, you get dermatology, you get behavioral health. It covers the entire household. If part of your household lives in Florida, part of your household lives in Texas, it covers them also.
If your son or daughter are away at school, everybody can be on that platform for that one low fee for the entire family for $35.
Great. All right, guys, you got 2 minutes. Ask any other questions. I'll post the link. And then in our private group, in the Fast Track Coaches Locker Room, I'm going to have Steve and Joey back. I'll let you all know when we're going to do the presentation for the group that's in the Fast Track Coaches Locker Room. And we'll talk about, for those of you that want more information as to how you can benefit from this on another level, we're going to do that presentation for you guys in the Fast Track Coaches Locker Room. But if you guys have any other questions, guys, is there anything else you want to share with the group before we close out? Anything you can think of that will help bring a little bit more closure to this whole process, what we spoke about tonight?
I think one thing is they only have 2 decisions to make. Are they going to sign up tonight, or are they going to wake up and do it in the morning?
Right. There you go. And Desmonica said, are we paying the $35 a day or more when we sign up? I think, no, it's $35 a month.
That's correct.
That allows you to have all the coverage, everything that Joe and Steve talked about tonight. It gives you full access to everything for everyone. And you're right, Jennifer, it's $35 a month for the entire family, not just one person. Whoever you guys put under family members, right, Steve? Whoever you add, they have access to that, and they'll get an email that will prompt them to complete the registration so they're on the platform. I have it on mine. I have my wife. I have all my kids. I can see everyone that's covered under this plan. No, Paula, there's no limited time offer. But I would encourage you guys to be proactive and take advantage of this. It's a wonderful platform. And like I said, I want to bring you guys as much value as possible so you can cover your family, or if you're having deductible issues, this will be a great segue to get you where you need to be.
I can point to this behind me, right, Coach?
Yep, you got it. You got it.
There it is. Affordable health care, $35 a month, no co-pays, no deductible, covers entire household.
Yep, your entire household. Guys, I really appreciate you guys. Guys, we're going to be back next Monday night, so make sure you share this video after we conclude. Share this video because we want an even larger audience next Monday night, because we're going to actually do a full demonstration with Steve and Joy going through the actual platform so you guys can see the whole thing. I'm telling you, it's so powerful. It's going to blow your socks off. But you guys give these guys a hand. Give them a thank you for coming in and sharing this awesome information. And we're going to be back live on next Monday night at 7 p.m. And we're going to do a live demonstration so you guys can see the back end of it. All right.
Coach. Thank you for having us, Coach.
Thank you.
Okay. All right, guys. We'll see you guys next Monday night. And again, thank you guys for participating in my live. We'll see you guys next week. Talk to you later.
Good night, Coach.